Now I'm going to take you to a party you'll never forget. It's a paranormal mixer. And by the end of this party, you'll know all about the Paramyxovirus family. Paramyxoviruses are single-stranded, negative-sense RNA viruses. We're using orange walls with warm tones to represent RNA virus. And what kind of paranormal mixer would take place during the day? Maybe a really lame one. But our paranormal mixer isn't lame, so it's taking place at night. So our moon, with a cloud that looks like a negative sign, tells you that Paramyxovirus is a negative-sense RNA virus. And because you're a genius, you know that since it's an RNA virus, it replicates in the cytoplasm. There is only one exception to this rule, and that's orthomyxovirus. Now, to remind you that paramyxoviruses are enveloped, let's invite some guests. It's those awkward, lifeless ghosts that always show up early to a mixer. The ghosts are covered in sheets, reminding us of the white robes in other enveloped virus videos. Additionally, the enveloped invitations to this exclusive mixer will be an extra reminder. Another general characteristic to know about this family is that they're all spread by respiratory droplets, represented by the droplets coming from the sprinkler system. Now, I'm sure you can tell me the name of the vaccine used to prevent measles, right? Yep, the MMR vaccine. And you should recognize this puppet show because it's the same one from the rubella video. It has 3 puppets for the 3 vaccines in MMR. It's also a live puppet show to remind you that this is a live vaccine. And the play has a familiar plot line with the evil villain puppet trying to vaccinate the pregnant puppet. And this is because, since it's a live attenuated vaccine, you can't give it to pregnant women. Thanks to the reduced vaccination rate from anti-vaxxers, we're seeing a rise in incidence of measles. Awesome. All right, let me start introducing you to some new guests down here. This ghostly weasel on the left represents measles. Now, something annoying about measles is that it goes by another name, and that's rubeola. To help you remember this, our lady weasel has a ruby-colored dress on. Notice how it's a Spanish flamenco-style dress to remind you of ruby hola, like hola, hello in Spanish. Now, let me just remind you that rubeola is not the same as rubella, and there's another childhood rash caused by HHV6. Do you know that one? Right, that's roseola, aka exanthem subitum, or 6th disease. So we have rubeola, roseola, rubella. You have to keep them all separate. This is rubeola. Okay, so what symptoms would make you think to diagnose your patient with measles? You can remember this with the 4 C's, symbolized by the C-shaped buttons you see going down the vest of this weasel dude. These C's stand for the prodromal, or early symptoms of measles, and those are cough, coryza, conjunctivitis, and Koplik spots. Well, okay, the last one's spelled with a K, but just pretend it's spelled with a C. And the weasel dude is going to demonstrate most of these symptoms. See how he's coughing? And notice he has a drippy nose. This is coryza, which is a fancy word for runny or stuffy nose caused by inflammation of the upper airway. Then for the conjunctivitis, his eyes are a bit red, or maybe they're just having a little too much fun at the party. Maybe he's gotten into the brownies. Lastly, Koplik spots is pathognomonic for measles. They'll be described as small bluish-white spots on a red background found on the buccal mucosa, or inside the cheek, near the second molars. We'll illustrate this by having our weasel eating some little blue and white candies from this pink mucosal-colored bowl. Here's what they actually look like. Although these don't look very blue, you do see the small spots with surrounding erythema on the buccal mucosa. Another important symptom is a fever, which can get pretty high, like over 40 degrees centigrade or 104 degrees Fahrenheit, and lasts about 4 days. We'll symbolize this by drawing sweat drops that are coming off of Papa Weasel. So that's the 4 C's: cough, coryza, conjunctivitis, and Koplik spots. About a day or 2 after you see Koplik spots, the patient will develop a maculopapular rash, which is demonstrated with our lady weasel. She's standing to the right of him to remind you of this progression. That is, if you read left to right. It can start near the back of the ears, then spread to the face and neck before traveling down to the rest of the body, and it's itchy. You may notice the rubies on this weasel's headband. They should remind you of the rubies from rubella video on the crown. This is so you know that the body rash starts from the face or forehead and moves downwards. Also, notice how some of the rubies are falling off the headband downwards. This is to represent that the rash progresses downward, just like in the rubella sketch. However, measles is more likely to form a confluent rash, which is why she has this solid ruby-colored flamenco dress on. And confluence just means that the rash starts as little small dots and starts blending together to form what might look like a ruby dress. This disease doesn't sound so bad, right? Screw vaccinations. Well, wrong. There are major complications to measles, too. One complication is viral or bacterial pneumonia, which we're representing with this weasel's untied, dangling bow tie that looks like two lungs. And pneumonia is never good, but they're still worse. Another terrible complication is called subacute sclerosing panencephalitis, or SSPE for short. It's basically inflammation and sclerosing of the brain caused by a persistent measles infection. So this third weasel up front here has a turban to remind you of the encephalitis.
SSPE is something the boards love to test you on, and this is how they'll do it. The story goes that the patient had a history of measles as a child, or they imply that the person was never vaccinated by saying that they immigrated to the US or something. Then 5 to 15 years later, the patient develops personality changes, seizures, myoclonus, ataxia, and eventually coma or death. So to diagnose this, you'll find anti-measles antibodies in the CSF, but even if you make the diagnosis, there is no effective treatment. Although it's a very rare complication, it is fair game for exams, especially as we start to see a rise in measles cases in the US. So to remember subacute sclerosing panencephalitis, or SSPE, take a look at this banner he's standing next to, advertising the puppet show. It's called Tales of Suspense.
Notice the U's missing, so it's SSPENCE. Viruses within the Paramyxovirus family can have one or all of the following virulence factors: hemagglutinin, neuraminidase, or fusion proteins. You've heard of hemagglutinin, or HA, and neuraminidase, NA, before if you've watched the Paramyxovirus video right before this. Do you remember what HA does? It's called hemagglutinin because it makes red blood cells stick together in test tubes. And that's why we have the lady weasel here reaching for this lovely plate of hors d'oeuvres, which consists of yummy tentacles and little red berries. The berries are stuck together and should remind you of red blood cells being stuck together. And there are tentacles on the plate to remind you of the parallel of HA seen in the Paramyxovirus video. And this turbaned weasel child here has something very sticky on his hands. And that's a reminder that measles also has the fusion protein. The fusion protein plays a role in the formation of syncytia, or multinucleated giant cells. In the case of measles, they're also known as Warthin-Finkelday cells, and typically they're found in lymphoid tissue. In addition to the many nuclei, you'll notice characteristic cytoplasmic and intranuclear eosinophilic, or red, inclusion bodies, and the presence of these cells is pathognomonic for measles. The one virulence factor measles don't have is NA, or neuraminidase, so you won't find that with any of these weasels. Did you know that there's a vitamin that's used to help treat measles? In fact, it's been shown to reduce the risk of complications of the disease and mortality. I'm talking about vitamin A. We'll represent this by adding a party hat to our weasel friend that looks suspiciously like an A. Let's move on to talk about another virus in the Paramyxo family, mumps. And what do you know? We've got our mumps mummies serving the hors d'oeuvres. And what big cheeks he has. That's because mumps replicates in the salivary glands, specifically the parotid glands. They can also be found in the testes, which accounts for one of the major complications of the infection, orchitis. Orchitis is inflammation of the epididymis and is seen when a teenage boy or adult man is infected with mumps. The inflammation is typically unilateral, but can occur bilaterally. As a result, there can be testicular atrophy and impaired fertility, but sterility is rare and is more common in men with bilateral orchitis. Now, we're a PG-rated, with subtle PG-13 jokes, educational product, so to help you remember unilateral orchitis, we've got this single orchid here as a subtle hint. Another serious complication is meningitis, because mumps can also replicate in the CNS, which is why our main mummy is wearing a neck brace, one of our recurring symbols for meningitis. Since mumps is covered by the MMR vaccine, a little mummy child is also enjoying the vaccine puppy show. And lastly, to cover the virulence factors, I bet you already noticed that since the mummy is handling the hors d'oeuvres, mumps is associated with hemagglutinin. And notice that the mummy child also has the sticky stuff all over his hands, which means that mumps has the fusion protein. And finally, for those of you who've seen the Paramyxovirus video, you may recognize this scalpel that the mummy is cutting up the food with. This is the symbol for neuraminidase, the third virulence factor that mumps has in its bag of tricks. So again, measles has only the hemagglutinin and fusion proteins, but mumps has all three. The third virus in this family to know is the respiratory syncytial virus, or RSV for short. As you can see on the tombstone right here on the right, kind of makes you think of RIP, right? RSV is seen in infants less than 6 months of age, hence the little baby ghosts emerging from the RSV grave. The virus infects cells by attaching to the respiratory endothelium through the G protein, and we've got this baby holding a G-shaped worm to remind you of this. A few diseases that RSV can cause are bronchiolitis, pneumonia, rhinitis, and pharyngitis, but the most important thing that you'll likely be tested on is that RSV is the most common cause of pneumonia and bronchiolitis in infants. If you look closely, all these ghost babies have a prominent bronchial tree all the way down to the bronchioles. They also have infiltrates to remind you of the chest x-ray findings. So based on what we've talked about so far, what virulence factor or factors do you think RSV has? I'll give you a hint. It's respiratory syncytial virus, meaning that they create syncytium, which are the large multinucleated cells that get fused together. Right, so they have fusion proteins as a virulence factor. Let's give one of these ghost babies some sticky hands. Still not sure what they got into, but no hors d'oeuvres or scalpels in sight, so RSV only has fusion proteins as its virulence factor. Ribavirin, a nucleoside analog, can be used to treat RSV infections in adults, but it's not commonly recommended for children or pregnant women. And we'll illustrate this with these ribs coming out of the floor surrounding the baby ghouls like a crib. Recognize these? It was in the Hep C video as well. So that's ribavirin. Palivizumab, a monoclonal antibody against the RSV fusion protein, or F protein, is used to prevent RSV disease in children who are at high risk, specifically those who are born prematurely. So let's make this baby down here extra pale for palivizumab, and he'll be shaking a rattle that looks a lot like an IgG covered in that fusion protein slime. The last virus we'll talk about is Parainfluenza. So let's take a look outside. This virus is the cause of croup, which is characterized by a seal bark cough and inspiratory stridor. And look here, we've got a confused seal, perhaps under some sort of paranormal influence, barking at the moon. Poor guy, just wants to be a wolf like the rest of his buddies. Just wants to be part of the croup. Get it? Alright, that's not funny. Anyway, see how there are 3 wolves? Since it was hard for us to put hors d'oeuvres and scalpels outside, we have these 3 wolves to represent the 3 virulence factors, HA, NA, and fusion protein, because parainfluenza has all 3. Also notice how the mummy is holding the hors d'oeuvres plate up to the window so that you remember that they have the same virulence factors. And I'm not sure if you noticed, but the building out here is actually an eerie-looking church that has a steeple. This is to represent the characteristic X-ray finding associated with croup, which is the steeple sign, which is the narrowing of the subglottic region that makes it look like a steeple on chest x-ray. So the steeple sign is definitely a radiographic finding you should be comfortable recognizing. Now, croup is something that mainly affects children, but adults will just get a severe cold. Also, another name for croup is laryngotracheobronchitis, which test makers may use in place of croup. And finally, remember inspiratory stridor as a buzzword for croup. And what's more appropriate on a chilling night like this than to have a howling gust of wind blowing open the church door? Notice that the wind is blowing the door into the church, and picture it making that howling sound or whistling. That's inspiratory stridor. Well, this has been some party filled with ghostly measle weasels, mumps mummies, infant ghosts with RSV, and a seal barking at the moon. A lot going on, but that's because Paramyxovirus is another high-yield virus.